A very good morning, everyone. Welcome to our forum organized by Universiti Kebangsaan Malaysia. We are blessed to be here today to witness a forum of the importance of the stress management. Firstly, I would like to thank everyone for being here today, our honorable panelists, distinguished guests, ladies and gentlemen. Before we begin, I would like to introduce myself. My name is NOORNAYTIEZLYA binti ABDULLAH. I am the representative of the Health Club of Universiti Kebangsaan Malaysia. Let me introduce you to our dedicated panelists next. Our first panelist will be Ahmad UZAEIR bin Ahmad RUDI, a doctor from Gleaneagles Hospital of Kuala Lumpur. Next to him is Puteri NURUL NABIHA binti ELIAS. She is a psychiatrist from Prince Court Medical Hospital. And our last panelist is Muhammad HAFIZ bin ISMAIL, the Councillor of Universiti Kebangsaan Malaysia. Before we begin any further regarding our forum for today, I would like to give an overview regarding to our topic for today. The focus of this discussion is on managing stress for a brighter future. It goes without saying that the subject is currently being debated since it has a lot of bad effects and impacts that affects everyone in society, regardless of their background. There are many ways and tips of handling stress among students, and obviously, there are many types and levels of stress. Thus, by looking at the bad side of stress, I think it is the best thing to discuss the healthy ways to overcome stress. So let's not waste any time and begin our forum. I would like to ask our panelist Ahmad UZAEIR a question. Panelist UZAEIR, what are the best ways of handling stress among students? And do you have any tips that you would love to share with all of us?
Thank you for the question. The aspect of the issue that I want to highlight is the way and the tips to handling stress among students. I will mention 2 ways how to manage stress and also for the tips. First way, handle stress from class, scheduling and credit load. As a student, follow the guide had given to you in taking credit subject by per semester. Also, create and choose schedule that's better suited to fit your needs and make it flexible. The second way is to overcome grade and exam stress. Today, many students are pressured to get higher pointers and grade. Consequently, students will learn under a high pressure. The solution, focus on your one exam at a time. Remember that you are in school for learn and grow. So, moving to the next point, in the tips to manage stress. First, tips from terms of health. Healthy is very important to every person, especially as a student. So, tips for maintain your health that can overcome stress is eat at the right time. So, eat a right time food at the right time can manage your stress. Second tips to overcome stress from finances. Finances are always be a problem for a student. So what you can do, divide the cost of housing, a food and a book. With that, there is no problem of lack of money which can cause stress. Thank you.
Thank you, panelist Ahmad UZAEIR, for enlightening us up. Next, I would like to point out to panelist Puteri NURUL NABIHA. How about we go through the types of stress that we might know in this age? And beyond that, would you like to tell us more about the level of stress?
Okay. Thank you to the moderator. Before I give more talk regarding stress, I want people to know and differentiate stress. Stress sounds like a simple word, but can contribute to our productivity in life. Thus, there are a few of them, such as acute stress. Acute stress is the most common form that every person experiences during the course of their life and is the result of recent or anticipated stresses. It can be both negative and positive. It arises quickly in response to unexpected or alarming events. It can be seen in stomach pain, heightened blood pressure, heartbeat, and chest pain. But we don't have to worry too much because it is so common and lasts for a very short amount of time. Acute stress is usually simple to manage and treat. There's a second type, which is episodic stress. Stress that happen over and over if one person was having difficulties on managing it. There's a type A, which is a person who is ambitious and workaholics and concerned with time management. Compared to acute stress, episodic stress can be really more extreme or occur constantly. It has been noted that it may be difficult for sufferers of episodic stress to get treatment because they are so used to feeling its effect and accept them as a normal thing. So the third type is chronic acute stress. Chronic acute stress can be thought of as a never-ending stress that relentlessly wears away at you. If you don't see an end in sight, if you are facing something that has no way out, then you are likely to begin suffering from chronic stress. It can be seen in never-ending stress, begin to suffer chronic stress and affect health. It can be seen in marriage, a toxic job, or poverty. This type of stress eventually begins to affect your health and can lead to your heart problem, strokes, or even cancer, among other issues. Chronic stress definitely requires reaching out for help. Treating chronic stress can be challenging and always necessitates the help of a professional like me, a psychiatrist, to make a long-term progress. So there are also some type of stress, which is time stress, anticipatory stress, situational stress, and encounter stress. And that's all for me.
Thank you, panelist Puteri. That was a great explanation. How about we move on to our next panelist? Panelist Hafiz, step forward a better tomorrow. How do we overcome stress in such a healthy way? And what about an unhealthy way? Who is common among teenagers?
Thank you for the question. I will answer it clearly and fast. A healthy method of dealing with stress. The first thing I can advise you is time management. Make a timetable for your everyday life to help you organize your time. It will arrange your life and allow you to spend time doing things that are helpful to you, such as spending time with family and friends. An excellent time management strategy is to take breaks between tasks. This will relieve you of tension. The second method is to have a healthy lifestyle, which includes sufficient exercise, a nutritious diet, and adequate sleep. If you can maintain all of these good habits, you will be able to avoid stress. I will encourage you, everyone, to avoid unhealthy stress management method. The first way that is common and popular among today's youth is taking prohibited items, such as smoking, drugs, or drinking alcohol. While you may believe that this item can relieve stress, they only do so in the short term and can harm your health and mental health. The second way that you should avoid is the habit of ignoring the stressor. Ignoring the stressor will make you burdened and will have an effect on your mental health. That's all from me. I will give back this stage to our lovely moderator. Thank you.
Thank you, panelist Hafiz. So my next question would be the same for every panelist. The question would be, what is your opinions towards our topic for today, considering your professional role? Why don't we begin with panelist Ahmad UZAEIR, as he is a doctor from Gleaneagles Hospital of Kuala Lumpur.
Thank you again. All we know, stress is one of the silent killers of an individual. If you see which one, it makes a person feel disturbed, burdened, and always in a state of restlessness. So, what the opinion that I can give based on my experience as a doctor? First, do not taking medicine when you're under stress. Why? Because it makes someone taking pills not in the right amount. And too many people nowadays, they take a shortcuts in dealing with the stress by taking pills, drugs, and everything uncontrollably. In fact, it poses a bad risk to their health. So, the second opinion is do an exercise. A lot of people and a lot of students today, they're ignoring the benefits of do an exercise. So let's see how exercise can help us to reduce stress. When we exercise, it pumps up our endorphins. Endorphins help us to increase our brain's production of feel goods, and it makes feel us more better. So the last point that I can share will be my opinion today is get enough sleep. Sleep 6 until 8 hours a day. So with that, you can get enough energy and create a cheerful feeling. So that's all. Thank you.
Thank you, panelist Ahmad UZAEIR. That was a great review as a doctor. Why don't we move on to our next panelist, panelist Puteri NABIHA. Puteri NABIHA, perhaps you might have your own opinion for being a psychiatrist.
So, as a psychiatrist, I would like to give my point of view based on my work field. So I want to everyone to know that it is normal for everyone to have stress. It also includes students, workers, and parents, and also others. But as they have stress, they tend to categorize their stress only in one category, even though there are so many types of stress that are common among them that they might not know. So if one person cannot identify what is their sort of stress, the person can have a difficult time on confronting the problem. The person can identify the problem itself, but it is recommended to seek for the professional to analyze it. By doing that, the person can overcome his or her stress slowly with the help of a professional. As time passes by, they will overcome the stress and make them feel better. Based from my own experience, among students itself in particular, mental well-being or stress is often overlooked because of its tendency to be invisible or experienced internally. It can also be hard to make the connection by yourself when the symptoms start affecting your mood, your academic performance, or your physical health. At times, it can feel like struggling in just being part of in college. I guess most people can relate to it. So, students have told me that they don't want to appear weak by asking for the help. Most students give excuses to avoid seeking therapy. And the most relatable excuses to me when I was a student back then was they didn't have much time to commit to the session. Therapy is more flexible than you people think. Going to therapy once doesn't mean that they are committing to a certain number of sessions. One person can go bi-weekly, monthly, or work with their counselor to set a unique schedule as needed. So although consistent treatment is often the most effective, it is okay to use the other therapeutic outlets like an app or free online resources when you have gaps in your counseling. So, lastly, if we look at it thoroughly, almost all the factors that mentioned before is the things that can contribute to our stress is what are the things that we are dealing in our daily lives. So, and it is not possible for them to avoid being stressed. Instead, they can cope with it from making it worse. And that's all for me.
Thank you, Panelist Puteri. That was a very lovely speech from you. We don't want to miss out our opinion from our counselor as well. I'm pretty sure that he has dealt with a lot of cases of stress among students. So why don't we hear his opinion as well?
Thank you. Many people I encounter at UKM always talk about stress and want to know how to prevent and avoid mental health issues like stress and anxiety. Almost 80% of those I encounter are UKM students, with the remaining 20% being outsiders. My opinion toward the topic, considering my experience from my life and daily work, are: first, time management. Reduce stress by providing you more control over your day. After that, a healthy lifestyle can improve your health and reduce stress. Any type of exercise can increase your fitness and decrease your stress. However, it's important to choose an activity that you enjoy rather than not. After that, several people in UKM have a bad habit of using unhealthy method to relieve stress. They do not consider the consequences and negative consequences of their action. For me, drinking alcohol, smoking, or using drugs can cause a person to do actions that are dangerous to themselves and others. And if someone just ignores the problem that he or she is facing and does not want to solve the problem, it will affect his or her mental health and physical. So if we want to reduce, we must face it and try to solve the problem. So as a good person, we must take a good way and never try the bad way to reduce stress. That's all for me. Thanks again. I give back the authority to manage this forum to our lovely moderator. Thank you.
Thank you, panelist Muhammad Hafiz. My next question is open for everyone. Which part of the text that can you use to pillar your views regarding this issue? Any of you have any idea?
So let me start for that question. The evidence that I can give based on my thought for today, according to one page named as a helpline page, they're mentioning if you're having a long-term stress, it can increase your risk of mental health disabilities. So clearly and no doubt, stress can affect your mental health. That's all for me for today. Thank you.
Thank you, panelist Ahmad UZAEIR. That's very short and sweet from you. Does anyone have any other ideas that you would like to enlighten all of us today?
Evidence that support the aspect that we have mentioned before? Now that is a good question actually. So from all the speech that I have shared, I have some sort of verification that can lead to it. And first of all is stress is the non-specific response of the body to any demand. Fink 2009. Everyone experiences stress at some point in life. Hans said, which is stated from the article. Not only that, I have also my subtitle article, which is it is sometimes easier for someone else to recognize stress in you, but not always so straightforward to recognize it yourself. It is easy to say the symptom will go away, but they may not. Go and seek for help if the number of symptoms in you is increased or changed and become more frequent, get worse, or are long lasting. And that is my advice and my evidence to you guys.
Thank you, panelist Putri. Perhaps, Mr. Hafiz, I guess we are all keen to know what you have to say about this.
So for me, that I can give from my research to you all is poor mental health of university students is becoming a serious issue in many countries, especially in Malaysia. According to a survey on mental health and wellness conducted by Rakuten Insight in Malaysia in May 2022, 59% of the respondents aged between 16 and 24 years indicated that they had a higher level of stress or anxiety in the past 12 months. After that, a study conducted by researchers in Malaysia between May and September 2020, mental health deterioration has been reported to cause increased level of harmful alcohol use, drug abuse, tobacco consumption, insomnia, anxiety, unhealthy eating, and higher case of domestic violence. That's all for me. Thank you.
Thank you, panelist Hafiz. I guess we're reaching to the end for our forum, but before that, let me summarize our forum for today. Stress can be defined as any type of change that causes physical, emotional, or physical strain. Any kind of change that puts physical, mental, or physiological strain on a person is considered to be stressful. Your body's reaction to anything that demands focus or action is stress. Everyone goes through periods of stress. Fear, worry, difficulty of reading, difficulty of concentrating, increased use of alcohol, tobacco, and other drugs are just a few of the symptoms of stress. There are many different kinds of stress. However, based on our research studies about the types of stress in psychology, stress can be divided into three primary types, which are acute stress, episodic acute stress, and chronic stress. However, how do you handle stress has a significant impact on your general well-being. You will grow more tolerant to stress as you develop coping mechanisms. It takes time to adjust to the new reality of working from home, being temporarily unemployed, homeschooling kids, and not having physical touch with other family members, friends, or coworkers. It can be difficult for all of us to adjust to lifestyle changes like this, manage our fear of being sick, and worry about those close to us who may be especially vulnerable. For those suffering from mental illness, it might be very challenging. And with that, I would love to close our forum for today. Thank you everyone for being here today, and thank you to our lovely panelists for today.